performing oropharyngeal suctioning. So this procedure is to remove secretions of the patient to provide the patent airway. So prior to the procedure, let's assemble the equipment and check its sterility. So this are the equipment, the basin, the sterile gloves, the pulse oximeter, the drape, the gauze pot, the suction tube, the suction machine, the saline, and the stethoscope. Next is, let's provide client privacy by closing the door, done, or draping the curtains, done. Then next is, let's perform hand hygiene, done. And then next is, let's identify the client's identity using identifiers, and let's introduce ourselves. Hello ma'am, sir, good morning. I am Giselle B. Esteban, your student nurse for today. May I know your name, ma'am? Can you state your name and your birthday? Okay, Mr. Papin, I am your nurse for today. Next is, let's identify risk factors or any airway obstructions. Then next is, let's assess for signs and symptoms of hypoxia using blanching test. Then next is, let's obtain the patient's oxygen saturation level by a pulse oximeter, and let's keep the pulse oximeter in place. And then next is, let's determine the patient's ability to hold or manipulate the catheter and knowledge about the procedure. Ma'am, do you have knowledge about the procedure? None? So, I will explain to you later. Then next is, let's auscultate for presence of upper respiratory obstructions and any adventitious sounds. Then next is, for planning, let's identify the expected outcomes. So, let's perform hand hygiene, gather equipment, and provide privacy. We are done in hand hygiene, then gather equipment, and also I'm providing privacy by closing the door. So, we are done. And then next, let's explain now the procedure. So, hello ma'am, this procedure is to remove secretions and then to provide you a patent airway. Then next is, we can encourage now the patient to cough out secretions, and also show how they splint or painful areas, and during the procedure, if the patient is able to have a coughing exercise or practice. So ma'am, I will give informations about health teaching about the exercises that you can use, like deep breathing exercise, wherein you can hold your breath for 5 seconds and then exhale all the air through your nose and mouth. And then next is, we can now position the patient, and we can now apply the drape. So, by positioning the patient, have the patient in a semi-Fowler's position, or just elevate the bed. And then now we can apply the drape. And then now is, we can now proceed to the implementation or performance of the procedure. So, for the first step, let's perform hand hygiene. Done. And let's apply a clean gloves and necessary PPE. So first, let's apply a clean gloves. Now I am done in donning the clean gloves. So next is, let's fill the basin with appropriate amount of saline water, usually 100 milliliters. And then now is, let's check the suction machine if it is functioning properly, and let's turn on. Functioning properly, turn on. And then let's connect the tube to the suction machine. And to check if it is functioning, let's sanction the water in the basin. So it's functioning. Then next is let's remove the patient's oxygen mask if there is, and let's keep that mask near the patient's face. And then next is let's insert now the catheter into the mouth of the patient along its gums, pharynx, and move catheter around until the secretion is cleared. And then now it is cleared, so let's encourage the patient to cough or replace oxygen mask. Next is, let's rinse this catheter with water until the tube was cleared of secretions. And let's turn on the suction machine and place this catheter in a clean area. Suction, it is cleared now, and then let's turn off the suction machine. And then disconnect, and then place this catheter into the clean area. And then next is let's wash the patient's face if necessary using the gauze pad. And then now is let's discard this soiled gauze pad into the proper area. And then next is let's observe for respiratory status of the patient. So if there is any problem, let's proceed the procedure. And then next is let's use standard caution of catheter if needed. And then next is let's remove the towel or drape, place it in a trash. And then next is let's discard the remaining water into the appropriate receptacles. The remaining water will discard. And then next is let's remove the gloves and PPE, dispose and appropriate receptacles, and then perform hand hygiene. And then next is let's position the patient and provide oral hygiene if needed. So let's position the patient and oral hygiene if needed. And then next is let's proceed to the evaluation. So first is let's compare the assessment findings before and after the procedure. So we can now auscultate the chest of the patient and airways for any adventitious sounds. So we can use the stethoscope. Let's auscultate the chest of the patient. Then next is let's inspect for the mouth of the patient for any vomiting. Then next is let's obtain post-suction SpO2 to measure and compare with pre-suction level. And then next is let's ask the patient to demonstrate how suction catheter is used. How the suction catheter is used, ma'am? Okay, it is good. Then next is identify the expected outcomes. Then for recording and reporting, let's record all the patient information in the appropriate log or the chart. And then let's record the patient and caregiver understanding of a safe oral sanctioning. So I will write my name. And then next is let's report any unresolved outcomes or any problems to the healthcare provider. And then now I am done performing as oropharyngeal sanctioning. Thank you.